You wake up, your stomach already feels swollen. By lunchtime, your jeans feel tighter. By evening, you look like you've gained several pounds. If this sounds familiar, your body may be trying to tell you something. Many people blame gas, stress, or getting older, but persistent bloating isn't always normal. While occasional bloating is common, frequent or severe bloating can sometimes point to an underlying digestive issue that deserves attention. Today, you'll discover 7 possible reasons you may always feel bloated, what warning signs to watch for, and simple evidence-based steps that may help. Meet Linda, a 56-year-old teacher. For months, she believed her bloating came from eating too much. She skipped desserts, drank herbal teas, and even ate smaller meals, but nothing seemed to help. When she finally spoke with her doctor, she learned that bloating can have many different causes, and treating the wrong one often wastes valuable time. This is a fictional example created to illustrate a common situation. The first hidden cause surprises many people. The first hidden cause is surprisingly simple: eating too fast. When you rush through a meal, you don't just swallow food, you also swallow extra air. That trapped air can build up in your digestive system, making your stomach feel tight and uncomfortable. Many people finish lunch in less than 10 minutes without realizing their body hasn't had enough time to properly process the meal. Try slowing down, chew each bite thoroughly, and give yourself at least 20 minutes to finish a meal. Eating more slowly may help reduce swallowed air and improve digestion for many people. But what if you already eat slowly and you're still bloated almost every day? The next cause has nothing to do with how fast you eat. It has everything to do with what lives inside your gut. Your digestive system is home to trillions of bacteria. Many of them help break down food and support healthy digestion. When this balance changes, some people may experience increased gas, bloating, or discomfort. This imbalance can happen after illness, certain medications such as antibiotics, or long-term dietary changes. It's important to remember that bloating has many possible causes, so persistent symptoms should always be discussed with a healthcare professional. Eating a balanced diet rich in fiber, fermented foods if appropriate, and staying physically active may help support a healthy gut microbiome. The third hidden cause is one that millions of people overlook every single day, and it may be sitting in your kitchen right now. The third hidden cause may be hiding in your refrigerator. Some people have difficulty digesting certain foods, even if they've eaten them for years without problems. Dairy products, wheat, onions, beans, carbonated drinks, and highly processed foods can trigger bloating in some individuals. This doesn't automatically mean you have a food allergy. Food intolerances and digestive sensitivities are different, and the exact cause can vary from person to person. If you notice bloating happens after eating the same foods repeatedly, keeping a simple food diary for a few weeks may help you identify patterns to discuss with your healthcare provider. Notice which meals trigger symptoms. Eat smaller portions. Avoid making major diet changes without professional advice. If symptoms continue, ask your healthcare provider whether testing is appropriate. But food isn't always the real problem. Sometimes, the cause is something your body desperately needs but isn't getting enough of. Fiber acts like a natural helper for your digestive system. It supports regular bowel movements and helps feed beneficial gut bacteria. Many adults eat far less fiber than recommended. When fiber intake is too low, food can move more slowly through the digestive tract, and some people may experience constipation and bloating. Increasing fiber too quickly, however, can actually make bloating worse at first. That's why gradual changes are usually recommended. Aim to increase fiber slowly through foods such as vegetables, fruits, oats, beans, and whole grains. Drink enough water as you increase fiber to help your digestive system adjust. We've covered 4 common causes, but the next one is different. It has nothing to do with food. In fact, it starts in your mind, and many people never realize it can affect their stomach. Have you ever noticed that your stomach feels worse during stressful days? That's not just your imagination. Your brain and your digestive system constantly communicate through what's known as the gut-brain axis. When you're under long-term stress, digestion may slow down or become more sensitive, and some people experience bloating, stomach discomfort, or changes in bowel habits. Stress is rarely the only cause, but it can make existing digestive symptoms feel much worse. Simple habits like regular walking, deep breathing, getting enough sleep, and managing daily stress may help improve digestive comfort over time. But what if your bloating doesn't come and go? What if it stays with you for months? That's when doctors begin looking for something more than simple digestion. One possible reason for long-lasting bloating is irritable bowel syndrome, often called IBS. IBS is a common digestive condition that may cause bloating, abdominal pain, constipation, diarrhea, or a combination of both. Although IBS doesn't damage the intestines the way some other diseases can, its symptoms can significantly affect daily life. Only a healthcare professional can diagnose IBS after considering your symptoms and ruling out other possible conditions. If your symptoms continue for weeks or keep coming back, don't rely on internet advice alone. Keeping a symptom diary and discussing it with your doctor can be very helpful. Most bloating isn't caused by a serious illness, but there are situations where you shouldn't ignore it. Seek medical attention promptly if bloating is severe, persistent, or accompanied by symptoms such as unexplained weight loss, blood in the stool, repeated vomiting, severe abdominal pain, persistent fever, or difficulty swallowing. These symptoms need proper medical evaluation. The good news is that many people can improve everyday bloating by focusing on simple, healthy habits. While results vary depending on the cause, these habits support overall digestive health. Eat more slowly, drink enough water, increase fiber gradually, stay physically active, get enough sleep, and manage stress. Small changes, repeated consistently, often make a bigger difference than extreme diets or quick fixes. Let's quickly recap what we've learned today. Constant bloating isn't always caused by eating too much. It may be linked to eating too quickly, an unbalanced gut microbiome, certain foods, too little fiber, stress, or digestive conditions such as IBS. The important thing to remember is this: bloating is a symptom, not a diagnosis. The cause can be different for every person, which is why persistent or severe symptoms should always be evaluated by a healthcare professional. Your body speaks to you every single day. Sometimes it whispers through small symptoms, like bloating, before they become bigger problems. Listening to those signals doesn't mean assuming the worst. It means paying attention and taking care of your health before small issues become harder to manage. The earlier you understand your body's warning signs, the more opportunities you have to make healthy changes. If you found this video helpful, subscribe to Silent Signs, because every week we explain real health problems using evidence-based information that's easy to understand. And if you often experience bloating, don't miss our next video. 7 foods that help reduce bloating naturally. You might be surprised that some foods people think are healthy can actually make bloating worse for certain individuals, while others may help support better digestion. Click that video now. Your gut may thank you for it.